I will say kids are so resilient. If you ever want to see how resilient kids really are, kids just kind of went, okay. And they went with it and they rolled. They were just honestly, they were thrilled to be back. And we had so many little guys who said, as long as we get to come back, we'll wear the mask. Like, we don't care.
Even though we're your boss, it's not our responsibility to ask you how to live your life a certain way. And you just have to make these decisions on your own. If you're going to the Super Bowl party and then you do get COVID and we do have to close down, that's not an issue for us to deal with. As business owners, we're taking that risk. That's our responsibility to follow. How you live your life is your own business. What we need from you is honesty. You need to say when you're sick and you need to let us know.
We have thousands of employees, but keeping our community safe was a very fine line for us. Every person I've come in contact with is genuinely invested and engaged in making sure we do everything we can to support people. And that's just across the board.
Hey everyone, welcome back to another episode. Today we have a great segment to discuss the impact of COVID on all different parts of the community. First, our guest is Linda Sistrunk from Memorial Health Systems. She's the Director of Behavioral Health. And then we also have Megan Miller, who is the principal at the Beverly Center from Fort Fry School District. And last, we have Sarah Sauls, who's the owner of Joe Mama's Kitchen in Marietta, Ohio. And we're really excited to get this discussion going. And today's episode is brought to you by Memorial Health System. And so we're very thankful for them to sponsor this episode of the podcast. Thank you.
And we know as professionals in this field, you cannot nap out of depression.
Is that really the only way we know how to communicate with people?
We've seen it before, and if we haven't seen it before, we don't scare easily.
I may be getting yelled at again. I'm not real sure what this is, but sure.
If I wrap you in bubble wrap, I'm not actually preparing you to live life on life's terms.
We need to talk about mental health just as much as we talk about physical health.
I don't know how well people are aware of what I think different sectors are going through in related to COVID. So we got school. And so I think there's both perspectives on teachers and students. Then there's the hospital, so nurses, but also, Linda, you're coming from a behavioral health perspective, just what has been the impact in terms of what you see in the emergency room and hospital in general. And then Sarah from Joe Mama's, the business sector, small business sector more specifically, but I think is that you have such a good connection with the community. And so I would say that you have probably a different view than maybe other people in terms of the community and how you interact and engage with them. What might the general public not realize about COVID and its impact on maybe your environment?
The perception is that COVID in a hospital system is primarily about treating COVID patients. The perception is the individuals who take care of the COVID patients come in every day well rested, well organized, well engaged in what they're doing. And that is true. The misconception is that patients suffer, but the staff who are caring for the patients suffer alongside with the individuals that are clinically ill. So our staff every day watch the symptoms, watch the lack of family engagement because of restrictions on visitation, watch a patient's decline, and emotionally they struggle with the idea that they are primarily the sole supporters for individuals who are coming to our hospital with a critical illness. It becomes a holistic approach with not only patients, but also with staff.
Are there things that you see how it takes a toll?
Yeah, my goodness. So we could start with just the national shortage in individuals who can take care of patients in hospital systems. We have patients who suffer from COVID, but we also have staff members who suffer with COVID. So if you are by any chance infected with COVID, you cannot work, you cannot be employed, you cannot come into our hospital system. That hurts their pay, it hurts their stability. It also hurts our ability to provide the amount of staffing we would like. It also completely depletes at times their emotional resistance to what we see in healthcare. So normal circumstances without a pandemic system, we are able to regenerate and rejuvenate our system by working 12 hours, working 3 days a week, or working full time, 40 hours a week, go home, refresh for the weekend, get away from some of the heaviness of healthcare. And the problem with COVID is the heaviness doesn't go away. People are working extensive hours and they are providing such emotional care to people that the level of emotional heaviness that they feel is not one they can regenerate through a couple of days off. It stays with them in a sense of having complete ownership of being there for that person, primarily when their family can't be.
So I'm hearing a lot of exhaustion and just not being able to probably provide the same level that they maybe could have in the beginning because they're just having a hard time keeping up.
I think they clinically are always outstanding. I never doubt our clinical skills. What I do notice is the emotional toll it takes on for our staff that they take home to their families, that they take on with one another. Now, there are positive points to that they are able to engage emotionally with one another and support one another and work with one another in ways that they never have before. A pandemic really systematically changes how we approach each other and how we approach our healthcare responsibility. It changes everything in the course of our daily schedule.
Yeah, absolutely.
So it has disrupted every system that we've ever been prepared for, made us rethink everything we do in healthcare. And COVID was initially a very temporary thought for us. And now it has become our way of life.
Well, I think that last thing that Lisa just said is a good point. We kind of were in the same mind frame that this would be a temporary thing and we would all kind of get through it. And now it just seems like this is how things are going to be for a while. And that's just another level of challenge for us. I think small businesses is how much we've had to adjust, how much we've had to change. Thankfully for us, we, our sales are still acceptable and we're making it, but we've had to change so much that we've had, our orders are not dine-in orders. They're to go or delivery orders. So the increase in cost to keep that going, those are all, carry out and delivery are both much more expensive to us as the owners. I think our staff, our employees, we have a really small amount of employees. So, if anyone in anyone's family becomes COVID positive, then that person has to quarantine. And when we lose one person from our team, we are struggling to keep the doors open. And then also as a business owner, from my point of view, struggling to help those employees, when things aren't absolutely perfect and the budget isn't exactly what we want it to be. And then your employee is forced to take 2 weeks off of work. That's hard on them. That's hard on us. And what can we do to help them? And outside of just serving food, there's been so many more layers of how we need to adapt and change to what is going on.
Because I do see a lot of relational strength with your restaurant and the community. And so I was curious, as the way you've had to adapt had an impact on that or on, or maybe taken a toll on you guys as far as not being able to connect like you used to be able to connect with your customers and be able to serve them in kind of a rewarding way.
I definitely feel a disconnect from the community as a result of all of it. Prior to COVID, we were already kind of having conversations with some financial advisors about my crazy plan of donating all of our tips every month and how, from a financial standpoint, that just is such a big risk and we shouldn't take those risks. And, Eric and I had lots of conversations about, we should only do 50% or we should, these kind of conversations. And it's something that I have stuck. So I've been so committed to that. And all of these people that I've talked to, I've said, but this, and in the last 6 months, we've had to quit donating tips because we just financially, I cannot win that battle with words anymore. And I can't say, but we're still making it. And those conversations that we had before, I can't do that. But at the same time, there's been so much silver lining that, because we're not able to do those things, I think we're hungry to look for other ways to help, with the senior meals. And just this past weekend, we matched every Valentine's dessert that was bought, sent a Valentine's to a nursing home resident. So we're looking for other ways that we can have an impact, and also ways have been more than just us, that have involved other parts of our community to, make it even a bigger community effort. So, when times get tough, you pull together more, and that's kind of a nice perk, that it's not just us collecting tips and handing a check, that we've been able to say, well, we're going to try to do this. And everyone in the community has stepped up and wanted to be a part of doing it. I think there's lots of positives too. You have to maybe search for them a little bit higher. I know, specifically speaking about the nursing home residents and sending those Valentines, they always have a special place in my heart. I spent 10 years in the nursing homes as a nurse, but most recently I have spent, every time I take the trash out, every time I go out the back door, I have seen family members outside of the arbors speaking to their family members through the windows. And that has been a big thing for me. Like, on a daily basis, I see those people, and I think that's a big struggle for them. We need to adjust, we need to do these things, but also lots of room for opportunity too, that to bring other people in and to keep the community in mind.
So on our end, Doug, we actually saw such an immense support for our staff. I remember the first day I went to the COVID unit and had to walk through and watch the actual care that was being provided in the staff. And then I got to go downstairs and meet a community member who donated a lot of wonderful food and snacks and supplies to our staff. And I'm not the most emotional person in the world. And it did make me cry, because I thought how wonderful it was that people acknowledge the sacrifice that people are giving for this illness. And our community has been stellar in anything and everything that we ask of them, they have done for us.
Crisis is definitely an opportunity for those things to happen, and it allows people to step up and do those things, and it's really nice to see. And don't blame you for being emotional, because it's a very heartwarming thing to see. Definitely. Megan, what about the teachers and schools? And I mean, this has been quite a challenging, since probably March, I guess. It's been quite a roller coaster.
School systems have really had significant changes that we've had to go through. Depending on your school system, it really depends on what types of changes you've had to go through. The last numbers that I heard, 70% of the districts in the state were either still remote or blended. That is not an accurate number for our local community. I think our local school districts have been really fortunate in terms of being able to be open. A lot of them have been full in person with a normal schedule. And then we have a few that have had to be blended in one way or another. I think that has had a significant impact on kids, on families, and on staff. If I have heard from just about every staff member, they did not go into the business to teach kids through a computer. And it's really, really hard to interact and create that relationship. When we went to online rather quickly in the spring and were just promptly shut down, our teachers already had relationships established with their kids, and they already knew their kids really well. So they could interact and kind of polish off and do what they needed to do towards the end. Then every district kind of had their opportunity to create their resume or restart plan this fall. And if, our district has been lucky enough, we've had 2 weeks this entire year that we've been blended, the week before Christmas and the week after. That being said, we've been full in person, but our environment has really changed. And so, we have little guys wearing masks. We have teachers wearing masks. We've got social distancing. We're constantly on kids about being inclusive and pulling kids in at their table. And now we're in a position of, no, you have to sit farther apart at the cafeteria table. And no, we only want you to have this many, kids in your group at recess playing. and trying to keep the school environment safe and warm and welcoming that they're used to, but then also trying to keep it safe and healthy has been a real challenge. I think that teachers have done an amazing job. Our little guys, when they can't read facial expressions because teachers have masks on, and it's really hard when you're trying to introduce kids to school and you're trying to introduce them to a new teacher, not being able to interact with mannerisms and facial expression and hugs. We are a profession that is in close contact with kids, and trying to balance that with what's healthy and what's safe has been a real challenge. Are you going to deny a 5-year-old who's sad that they left mom and dad and came to school a hug? Well, no, you're not. But how can you do that in a safe a safe way? So the physical environment of schools have been significantly impacted. I will say kids are so resilient. If you ever want to see how resilient kids really are, we had visions of how, traffic going this way and traffic going that way and spreading them out, and how we were going to contact trace at recess was going to work. And kids just kind of went, okay. And they went with it and they rolled. They were thrilled to be back. And we had so many little guys who said, as long as we get to come back, we'll wear the masks. Like, we don't care. And so they were just glad to be back with people. And it's really hard to learn online, even as an adult. When you take an online class, it's really hard, especially depending on what it is, to teach that content to yourself. And they were really glad to be back in person with teachers and with other kids. Environmentally, for kids, it has also really impacted them socially. And so kids are social little beings, and they're used to pee-wee leagues and sleepovers and after-school dances and football games, and even elementary kids go to the high school football games and the high school basketball games. And all of those social opportunities were just basically, they were removed, they were, or reduced. And that's a bit difficult for kids.
So let me ask you this, because you've mentioned several things that you guys have had to reduce or eliminate in order to provide a safe physical environment. You mentioned touch, physical, safe physical touch, emotional engagement through the full facial expression, but then also just not being able to do things that they normally were able to do pre-COVID, like go to football games and things like that. What are some of the ways that you've seen that impact?
We had to, in a lot of ways, really change how we do business. I would say until the CDC changed some of the contact tracing guidelines. So we are a business of teaching kids 21st century learning skills, which is all about group work, collaboration. We have made such an effort to eliminate desks in our classroom and put tables. And so then we were faced with the challenge of, we're all the time working with kids on collaborating with each other, and now we've got to spread them out. And now we have to figure out how to teach and how to have kids learn when they cannot collaborate as closely as possible. So, we've been able to use technology in that way. The social and emotional impact, I think that it is harder for kids that struggle with social and emotional skills because it's not as easy for them to watch and mimic others. So, when we don't have opportunities for group work, then they're not learning the skills. Like, learning how to function in a group is a group skill. And when you're not able to offer as many of those opportunities to kids, their ability to communicate with each other, their ability to work with people and other kids that they wouldn't necessarily socialize. So a lot of it is that inter and intrapersonal communication. There's a lot of stressors on families that weren't there before, especially for some of our families that haven't necessarily I would say, have been pretty smooth until COVID hit, until they were, laid off and hours reduced and benefits reduced and all of those things. So some of our families that have typically been stable in the past now have additional stressors. So we have kids that are not normally haven't been on our radar are coming with stressors.
They feel that stress, right? They
definitely do.
And they bring it to school.
Stress. They know that things are different at home, and they come into an environment at school where typically they know what it's like, and it looks different now too. And so we really had to counteract the classroom looks different. We have desks and we're spread out, or we have dividers, or we have masks, but we're still the same, we're still the same here. We're still going to do what we can do. But a lot of the social, emotional, and coping skills have definitely been impacted due to all the different environments and stressors that kids have.
Yeah, I think that healthcare workers thrive on talking to other healthcare workers. So a majority of our passion comes from listening to other stories, interacting with people during lunch, talking at the nurses' station, reviewing our crisis plans in our offices, engaging in meetings where we collaborate, where we develop different plans and ideas. Going into offices, we've had to really halt a lot of in-person interaction. I do a lot of talks with our new employees, and I do a lot of talks within our system, and not being able to do face-to-face, it depletes some of my energy, I guess, and my ability to be excited throughout the day. Now, we have to find new ways to do that. So we have to find new ways to engage with our coworkers. And regardless of what you believe, there is something about coworker relationships that impacts so significantly what we do when it comes to patient care. If we engage with one another well, we increase our positivity by being together and talking with one another, it ultimately affects our patients a certain way. So we've had to be creative in our approach. We've had to limit how many people are allowed to be in an office. We limit our face-to-face lunchtime. We limit our face-to-face meetings. In that regard, initially it was fun because we could all kind of stay in our offices. We can work from home. We can use our cell phones and do our meetings. And then we realized the impact it had on the heart of what we do. And so we have been able to engage a little bit more openly and cohesively with small groups periodically now, that we do see the vaccine coming out. We see our numbers dropping. But I do find that we do much better if we're able to engage with one another. Our patients, I'm kind of with Megan, patients see our facial expressions. They want to see us smile. They want to see us engage with them with a good facial expression that shows we're open, honest, good, compassionate individuals. And a lot of that comes from our face. So I find that a lot of our patients have a difficult time understanding the intent of what we're saying because they don't see our facial expression. So we have to almost overly engage at times with what we're saying so that they truly understand that our recommendations, our education, and our interactions with them are from a pure intent purpose. And I deal with a lot of mental health and folks who are struggling emotionally. So it is so important that they understand that I am a compassionate human being who is engaged in their emotional stability, and that's hard to do with a mask on your face.
Yeah, and facial expressions is a huge part of communication. So, if it's a huge percentage of it compared to the words. So, yeah, it's definitely a drawback in that. How about you, Sarah?
I think the mask thing is a huge thing for us too. We kind of pride ourselves on trying to know every person that comes in. If we don't know you, we want to learn your name. I'm a big supporter of smiles, like that. A smile does wonders for anybody. And they're not getting to see our facial expressions. We're not getting to see theirs. On top of that, there's usually a plexiglass shield between us. So there's definitely a level of disconnection that we didn't feel before. And you kind of have to push yourself out of your comfort zone to be even more engaging, like Linda was saying, so that they do know that you're smiling behind your mask, or that you are interested in what they're having to say to you. I think the social aspect has really, we've seen that effect in Gym Mamas too, that, there's not a lot of lunch gatherings, and there's not a lot of people coming in that are meeting up for lunch. That's sad to watch in our dining room, that there's not, as much of that interaction, and that there's not, I think people are just still being careful, as they should be, but, not having all of that interaction in our dining room and seeing people coming in, we want to be a place where people gather, and right now gathering is frowned upon. So it's that's a struggle for us, and I think for our customers, that they want to, they're hungry for that, not just for food, but for that emotional and community kind of connection, I guess. And I guess also emotional on our employees, just trying, I think that they're worried what the next steps will be, and if we're going to be able to keep things running. And, there's a lot of emotional layers, I think, in all of it.
Yeah, well, and I think there's a parallel in all three of your sectors, and one is that togetherness is what helps you get through times and challenges and stressors, and the very thing that would help, like Linda's, the staff at the hospital would help them get through the COVID patients and the stress of that would be to congregate and connect and relate, and same thing with teachers and everything like that. And those are things that are not able to happen in the way that we naturally would want to happen, which kind of leads me into my next question, which is, what's the impact you've seen on the mental health of our community?
So I think that initially we saw a decrease in people coming to the hospital for mental health concerns. I think people were able to adapt for a very short period of time. About 6 months in, we started to see a massive increase in individuals who were coming to the hospital for grief related to COVID, for not seeing, and most of it was not seeing their family members. We have an older population who they don't get to see their grandkids. We have families who have custody issues, and one parent may have COVID and the other one doesn't get to see the kids because they're quarantining at the other parent's house. So we've seen a significant increase recently, and this is the sad part of COVID, is where individuals have actually passed away from COVID, and the guilt of the family members who were not able to see that patient, the guilt of not being next to the person you love when they die because of restrictions. And that's not just our hospital. This is across the state of Ohio that we see a lot of people coming into our hospital and saying, I didn't get to be there with them in their last stages. I didn't get to see it. They didn't know I was there. They didn't know that I cared. And so it's taking on a toll that's different than normal mental health. Normal mental health is sometimes I'm depressed. I have anxiety. I have psychosis. I have a mental health disorder that this is a newness that we weren't prepared for. The guilt and grief that people are suffering is taking on a mental health crisis that we don't necessarily know how to fix. I had a gentleman I spoke with today, and there's nothing I can offer to a person who tells me that they did not get to be there when the person they loved for, I think they were married 42 years, when he didn't get to be there with her. There's no medication that can take that away. There's no amount of talking and therapy that can make that better. And I think that new approach to mental health is devastating for us to watch. So that's been a difficult one. The other thing I think we have seen is that the resources we have are limited if you're COVID positive.
Right.
So we can offer all kinds of resources in our communities, unless you're COVID positive. And so it has been a juggling game for anybody that we can get help if they are COVID positive, and trying to get them the available resources they need has been probably one of the biggest barriers in our healthcare system. It's been a rough. Now, fortunately, everybody that we've come in contact with, we've been able to work it out. But that in itself has been a crisis.
Yeah, and I was teaching a class today and talking to them about stress, and the students, we were talking about COVID stress compared to pre-COVID stress, and invariably almost all of them said that they just worried all the time about whether they were going to test positive, and were they going to be impacting other people, or were they going to have to isolate from everybody because of that, where it was going to impact the things that they do in their life that they really enjoy and are really helpful for them, or a responsibility that's really important to them. They were putting that at risk because they were getting unhealthy, or they were going to get a positive test result. And so that was particularly challenging idea that we have to kind of walk around always worried, it takes a toll, it adds up, it wears on you. And so, like you said, we have to have the resources. So not only if you're testing positive, you can't access those resources as well, but also COVID's taken a toll on the resources in general, just people testing positive and, teachers going out and, those types of things.
I think emotionally at a school system, it's been difficult for staff because they have a lot of those stressors on them as well. They don't want to do things socially and outside of school where they normally socialize with each other and kind of get back on track, especially even with their families, because they don't want to pick up anything outside of school and bring it to school. Mm-hmm. So I've had a huge number of staff that have been very stressed and anxious about what they're doing in their normal lives that might impact a family or kids negatively, or have to be quarantined, and then what happens when they're quarantined to the education of their kids. So, there's been that emotional impact. Our kids feel the impact of not being able to see grandparents. For a lot of our kids, grandparents are the stable factors in their lives. And whether the grandparent may or may not have custody, they still spend a significant amount of time with them. And now that's being limited. So then they're kind of thrust back into a less stable environment in situations. And then in just some situations, they just don't get to see their grandparents on the weekends, and grandparents don't get to come and watch their games. If they've been lucky enough to play a sport, it's really important to little guys to have their family there to support them. And they're hopefully able to have one or two parents there. And so, they have that sense of isolation. A lot of stress when kids we had a significant number of kids that not significant to us, it was, but where they had to go into quarantine situations, where a parent tested positive or they were close contact, and they were under a huge amount of stress as to whether or not they were keeping up with their schoolwork, because they would be at home for 2 weeks and we'd be trying to log them in on Zoom classes and keep up, but the whole rest of the class was moving forward. Right. So they were getting new content in person, and then they were trying to teach that on their own and keep up with their peers and not see them. And that was a huge amount of stress for kids.
That's a different learning experience. If the kids that are in class getting a different experience than the kid who's having to watch it on his computer or phone, maybe he's just watching on a tiny little phone, and that's certainly an impact.
In my building, and I'm sure other buildings did as well, we had great staff and great kids who would eat their lunch in a classroom and spread out, and they would have a Google Meet lunch with their buddies, so that they could have that kind of non-structured situation where they could just still socialize and be with their friends. But I think that sense of isolation, the separation, the stress, and just having a lot of the things in their world that have been consistent change, learning to cope. I think we've also, especially at the elementary level, had a pretty significant increase in the need for social groups. Mm-hmm. Because when they do not have a lot of social opportunities outside of school and within the classroom, a lot of those social difficulties tend to arise in terms of, well, how do you communicate with each other? So I would say one of the big changes that we've had to make inside of school would be a whole grade, like a whole class and small group social skills to try to counteract the removal of social situations that kids have been in.
Yeah, and I think that along with that, Megan, is when you have a family who's quarantined together, I have heard there's families who love to hang out with each other in a quarantine. They play games and they just love it. They watch movies and Netflix marathons, but the majority of people don't do well being in an area for very long periods of time together, especially with children. And so we have seen an increase in individuals coming to the emergency parents. We've had a lot of the not the primary parent, let's say, dad lost his job due to COVID. So now he stays home with the kids, and that has created a crisis for dad or mom or, whoever is the primary caregiver. And the kids have realized that their lack of socialization also increases the intensity of their personalities. And the parents just aren't used to having kids 24/7 for extended lengths of time and being able to keep children stable through this period. And so we have seen an increase in our children, not necessarily coming in for suicidal thoughts or depression, but because their mood and behavior is so volatile right now that the parents just don't know how to manage it. We always had teachers help us, right? And we've realized now that teachers are probably just as significant as therapists in our community, because teachers have balanced what we do at home. And when you don't have that, it increases our crisis at home a lot.
Speaking from experience, not having to go places to do like sports and do all these things and just be able to stay home and spend time together was very rewarding. But over time, it catches up and it gets really exhausting because, it's a lot of hours to try to figure out what to do to keep them occupied and busy, involved in stuff. And there's only so much. And so it can take a toll. And then, you recognize that, they need more than just us. They need to be with their friends. They need to be spending time with their friends. That's another element to their life and their well-being. And I can't fill their, that void of not having, their friends and being able to do those things. So I think that is challenging. In the beginning, like you said, it was probably like, oh, there's just some things that we'd never got to do before. We get to slow down and everything like that. And now it's like, oh man, I need breaks. I need other things to happen. Those type of things. Sarah, do you have any thoughts in terms of any mental health impact that you've seen from your perspective?
We have a lot of employees that are worried about if they get COVID and we have to shut related to that. I think they bear a lot of stress about that. Like I said, we're a small team. So if someone goes down, it's hard to keep the ship sailing, I guess. So I know we've had to have a couple conversations with, even though we're your boss, it's not our responsibility to ask you how to live your life a certain way. And you just have to make these decisions on your own. If you're going to the Super Bowl party and then you do get COVID and we do have to close down, that's not an issue for us to deal with. As business owners, we're taking that risk. That's our responsibility to follow. How you live your life is your own business. That was a big conversation we had to have with a couple employees because they were so worried about, well, what if I go and then I get COVID and then you guys have to close down? Well, we can only control what we can control. And as business owners, what we're going to control is, okay, if someone comes back sick, then we're going to do what we need to do to keep the community safe. And it's not about what that person did or whatever. You can walk into Walmart and get COVID. So I think there was, especially at the beginning, some conversations about how, it's not really mine or Eric's business what you do on your off time. What we need from you is honesty, and you need to say when you're sick and you need to let us know, and, trying to kind of relieve that stress from them, because when you're one of a 6 or 7 person team and you're the person that has to call in and say, I've got COVID, luckily the only time that we have shut down, it was our own our own family. So that, was a relief to everyone else.
But that is an interesting concept, because we have thousands of employees, and trying to promote a healthy balance of still having your own personal beliefs and needs, but keeping our community safe was a very fine line for us.
Yeah.
We initially just requested that the same thing that Sarah said, just be honest about what you're doing, and if you're sick, please stay home. And but with thousands of employees, you have to have some consistency and expectation that you're going to keep our hospital system safe and the people around you safe. So that was an interesting portion of the pandemic. And I think probably with you also, Doug, we cannot tell people what to do in their private time, but we do want them to be respectful of the responsibility of not spreading an illness that hurts people.
Well, and we talked about, you have your responsibilities, and there's things that, to your family, and there's things that you're expected to do, and we get that. And so luckily we had a mechanism for them to still work from, to get the option to work from home and do those things. But there is, for me leading the whole organization going, if you could kind of limit the amount that you do just to kind of reduce the risk, that would be greatly appreciated. But like you said, I can't tell you not to do it, but just try to be as safe as you can, so we're not, dealing with that. Because every time, we ended up quarantining, regardless of whether they had it or not, we ended up quarantining people for precautionary reasons.
And as a leader in the system, I haven't been on vacation in a year.
Right.
Because I'm not going to be seen on a cruise. I'm not doing anything yet. So I have been very limited in what I do, because I think people follow the leader on some of that philosophy.
Everybody has their different views of kind of how they should act during this pandemic, but the theme across all three of you is team. So there's that element of we're a team, and we have to be in it together so that we can get through this. And so that really involves us being thoughtful about those things, like the decisions I make. What kind of impact will it have? Not that you have to feel shame and guilt over positive tests, but just to be thoughtful of those things is kind of the way we've tried to approach it.
I think that is probably one aspect that I was not prepared for, is in just within our district staff, how varying opinions were on COVID, and how that impacted them with each other socially. Because you would have one person that maybe didn't take it as seriously, or who was more down one path, and somebody that they are very close with and worked very close with was very going down the other path, who was very concerned and very procedural. And having that was a big social emotional blend for staff, trying to find a common ground where they could say what they needed to say and behave how they wanted to behave, and not create a lot of controversy and conflict. And so that took some time for everybody to work out, in terms of, here's the procedures. It doesn't matter, how you feel or what you believe. And then on your own time, it was really interesting to watch the dynamics of your staff and how they work that out amongst themselves.
COVID's been a long time. It's been since March, maybe February, depending on, I can't even remember now. But what is one thing that maybe you've really learned from COVID that you think will help you moving forward, or something that you've gained from COVID, what you've taken from COVID that has not been in the negative impact way, but maybe has positively changed things?
From our end, we have had such a great time trying to work around COVID. In the sense of not losing the personal touch with individuals. We've initiated a lot of telehealth. We have initiated a lot of programs in our hospital system that are actually just sensitive to patients' emotional needs. We developed a program where if you're in here for extended periods of time, you can put in a request for something that alleviates your emotional stress. So we did that with the intent of allowing people to stay busy. We thought we'd get like crossword puzzles and stuff, but we're getting the oddest requests. People want like KFC chicken, and they want particular books, particular movies. And we've had so much fun making sure that we are creative. Our physicians have taken the role of being activities coordinators. Our staff have taken the role of being emotional champions for people and doing just that little extra thing that we may have not thought about before, but now we make it part of our daily routine. I think it has made us more appreciative of the personal relationships that we have developed over time in our community. So when I see somebody now, I am so genuinely excited to see them that I actually engage with them differently. And I take time to spend time with them and collaborate with them and appreciate them and speak differently to them because I don't know the next time I'll get to see them. There's a lot of bad that has been generated through COVID, but I would almost say there's more good in the sense of the true, passionate, compassionate, kind, awesome care that this community has given one another. Every person I've come in contact with is genuinely invested and engaged in making sure we do everything we can to support people. And that's just across the board.
That's something that we've all been able to kind of come together on and agree on. There might be some procedures and policies that we don't all come together and agree on, but the idea of caring for our community is something we all come together for, which is really nice.
There have been routines that we've had to change for COVID that we actually kind of step back and go, wow, that worked pretty well. For parent-teacher conferences, we did not have parents come in one-on-one unless there was a need, but we did phone conferences and we did lots of virtual conferences. And we had a higher attendance rate for conferences than we've had in years because they could do a Zoom meeting while they're driving to practice or driving home from work. So little things like that, I think we've kind of found a different way of doing things that might be a better way of doing things. And kind of, I think the main thing that I would say a good that has come out is the strength in communities. When I talk to other principals in the area, they have had more community members call in and say, hey, if you have a family that has really been impacted, let me know and I'll help out with bills. And who they've donated bottles of water and they've donated masks. And we have had more communication, not just from businesses, but also just individuals, who have called in wanting to help somebody in some way. And I think that has really been a significant positive impact. And I think that those relationships were always there, but we didn't necessarily have a need for them to reach out, or they didn't have a need to reach out until it was presented. And now they really enjoy being a part of something in some way. So I think those are some definite positives that have come out of COVID.
I think I'd have to go right along with both of those. I'm obviously a big cheerleader for community, but I think one of the things I learned in the past year is that I don't need to carry so much of that burden on myself. That typically if I say, hey, let's try this community jumps in. Like I, at times have to say, well, we've got so many people to help. Let me put you on the next project or whatever. But in the last year, I mean, just the amount of people that have stepped up and stepped in and wanted to make a difference. And Megan said, you don't really know, you don't know those people are out there unless that need is presented. And then when the need is presented, these people just come out of the woodwork that, wrote a check or used their card to deliver meals, or, went out of their way to make sure we had something to put all of the meals in, things that you don't even think of, that you're not even aware of are going to be issues people have already resolved for you before the issue even comes up. I think that is the biggest positive for me from COVID is knowing how great people are here and how they want to make sure that they're involved, even when it's, when it could potentially be unsafe for them. We had people that were delivering meals right to an elderly person's doorstep. And in some situations that could have been a risk that they were taking, but we had so many volunteers that at times we had to turn people away, so to think that, people aren't afraid of that and that they want to make a difference and that they want to come in and that they want to be a part of something is, I think it speaks volumes about our community and who lives here and who makes a difference here. So
what are things that we think are going to be important for our community to continue to get through this and, thrive beyond, wherever this leads?
We continue a lot of the stuff we've talked about in the last hour, that you have to, even when you yourself are overwhelmed and when you feel isolated and when you feel like, oh geez, there's all of these steps that we have to take just to clean a table now, you still have to remember to grab the person who's next to you's hand and bring them with you, and to include someone, maybe not actually grab that hand, but metaphorically.
Metaphorically, yes.
Yes. Remember that there's someone beside you and that you want to bring that person with you, and, and to continue that chain, to just continue reaching out to people and continue trying to find a way to make a difference, no matter how small it is, even if it's, just telling someone that tomorrow, is going to be better for them, that we have to continue thinking of others. That's the most important thing, I think.
And I think if we all continue to voice pride in being able to take care of our community, every person that we come in contact with is impacted by that and actually can grow to also feel pride in being able to help people. I said initially when the hospital was really closed off and people weren't coming in and people were really afraid of COVID, I remember telling my coworkers and my staff, you couldn't stop me from coming here, because I think it is the biggest honor to take care of our community. If I can come in here and I can be here every single day to take care of our community, it's a huge honor to do that. And they were like, yeah, you know what? That is a huge honor. And then we continue to voice pride in one another for what we've done. I watch Sarah every day and what Joe Mamas does for our community. We talk about it consistently through our community. Life and Purpose with Doug. I've watched you adapt your schedules and your staff adapt their needs to make sure everybody's needs are met in the school system. I can't say enough about the school system. So I think one of the biggest important things is that we continue to voice positive verbalizations just across the board to anybody we can about how prideful we are as a community to be helpful and how proud we are of one another for what we've done.
Definitely. I think that, and just showing empathy for one another, if we can continue to extend that compassion and empathy towards one another, that I hope that's something that sticks around and helps continue to push everybody through everything.
Yeah, absolutely. And I think the things that this crisis has made us do are things that we should do even if this crisis wasn't here. Love the idea of celebrating our pride and letting people know all the good things that are happening. Sarah with reaching out and in just small ways, I think is such a powerful thing for our relational connectedness. Obviously, I'm a big proponent of compassion and empathy, and I mean that's the nature of my business, and just having understanding like what Megan is talking about, I think is really important. Seek first to understand. I think that's going to help us definitely get through together. So I appreciate Linda, Megan, Sarah, you guys joining me today for this episode. I think it was a really important conversation, and I appreciate everybody's wisdom and observations about this time. So thank you guys.